Here, everyone. I'm Eric Connard.
And I'm Neda Iramport. COVID-19 cases, they're rising at an alarming rate all across the country, including here in San Diego.
Yeah, we were just looking at the latest case rate numbers here. This morning, county leaders gathered at a testing site in City Heights to meet with workers and discuss this latest surge. News 8's Chris Groh got the chance to meet up with them afterwards and got an update on testing availability.
And the people that are behind me here in line, they've been waiting up to an hour. So we're still trying to see exactly how long it's taking some people to get all the way through once they begin. But take a look at this. This line wraps around this athletic center here in City Heights. So again, the signs that we're seeing coupled with the stats that we are seeing have a lot of people worried. Remember, just last week we heard that report that nearly 6,000 COVID-19 cases were reported here in San Diego, the largest single day total since the start of the pandemic. So today we heard from county leaders on this issue, specifically what's going on. Why are we seeing such an increase in testing numbers as well as case numbers? Why are we seeing these long lines? Well, specifically with the long lines, these sites have large capacity for walk-ins on top of appointments if it is going to be a site with appointments. There are about 24 sites across the county. In total, they're performing about 5,500 tests a day right now, about 47,000 a week. So again, the demand is really high. They do not feel that there is a short supply of tests right now, but simply there is a high demand brought on by the more transmissive Omicron variant, in large part because of that. And that's putting stress on both public and private testing sites. So again, the question, should we be alarmed? Supervisor Nathan Fletcher says taking precautions is always going to be a good strategy for those of you at home in line getting tested. However, he doesn't believe we're headed towards more mitigation efforts or closures or anything like that because hospitalizations are down. He told us there were about 1,800 at this time last year, only 600 so far during this time span this year. So again, a big reason why we're seeing low hospitalization numbers, the vaccine and the booster, and county leaders are confident, again, that they have the resources right now to get through this point in time.
One of the things that's different about Omicron, the data is still a little early to say that it's less impactful as a variant. It may be because our community immunity is better because of vaccinations and boosters and natural infection. But one thing we are seeing is that the hospitalizations are more rapid. That is, people tend to have shorter hospital stays now when they're admitted than previously, and that may be one of the reasons why we're able to keep the total low, is that the turnover is a little faster.
And another interesting note here, of the tests that are administered here in San Diego County, the actual county public health department only does about 10% of the total tests, and 90% of them are administered through CVS, Walgreens, and other private entities.